Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. We're here today for a special video series outside of our normal Friday schedule. And that's because of the announcement that came out yesterday, January 19th, by the Department of Health. As you may have heard now, the Department of Health changed the Pennsylvania vaccination plan to include anyone over the age of 65 and anybody from 16 to 65 who has an underlying health condition now are included in Phase 1A. We learned about that news when you did, so there was no advance notice to healthcare providers and hospitals across the state prior. And you can imagine, as soon as that got announced, we started getting calls, emails, and texts immediately, all afternoon and evening and into today, people asking when, how, and why they can get their vaccine. Some people very courteous, some people very demanding. And so we're here today to give you an update of where we stand with the process and what we're going to do about it. So where we'd like to start is asking you to be courteous. Remember, we're going to work with you as much as possible to try and get this done. You need to be patient with us. Like you, we're hearing the news on the fly and we're trying to react to it as quickly as possible. But if you can be courteous and patient, we'll be courteous and patient back as well. We're all in this together. We need to try and accomplish this as quickly as we can. Currently, we only have a few thousand doses, and so that's one of the limiting factors we have. And so rough math, looking at the announcement yesterday, we think there's approximately 80,000 people in Washington County alone who are now automatically in Phase 1A who weren't before. And you can imagine, if we only have a few thousand doses, we can't get all them done immediately. On top of that, we need to save some of those doses for second doses. People who got their first dose from us 2 or 3 weeks ago are now being scheduled to come back in to get their second dose. And so some of those doses we have to save for those folks. And then on top of that, we already have our COVID vaccine schedule full for next week. So it's going to take some time. We need you to be patient. So where does that leave us? First, if you could do us a favor, please stop calling, emailing, texting us, asking us questions about when and how you get the vaccine. That actually bogs us down. It wastes your time and it slows down the process for everyone. If you could just be patient, that would be helpful. We're going to be launching on our website soon. I don't know the date exactly, but soon, a spot where you can go and sign up to get a COVID vaccine from us. When we get that ready to go, we'll communicate that via our website, Facebook, our email, e-blast about COVID, and on our COVID phone message. The best way to get updates so you don't have to come back and check all the time is to sign up for the email e-blast. You can go to our website, WHS.org/COVID, to sign up for that email blast. You'll get updates on COVID, but you'll also get an update about when this form is available to sign up and when that's going to go live. So we'll get that going as quickly as possible. We don't know when yet, but that's going to be the best way to do that. We will not be reaching out to individuals who've already called us. First, we haven't been maintaining a list. Secondarily, we don't have the manpower, frankly, to call back the hundreds, at this point, probably thousands of people who've reached out to us. Again, the best way to get an update is to sign up for that e-blast so you know when that form is available and when you can sign up. As a side note, the county about a week ago launched their own website where you can sign up, and they have us listed there. Unfortunately, we're not using that, and that doesn't work in our process. And so I apologize for the confusion of that. I think there are people who went there, signed up, selected us. That won't work. And so when we get our site up and running, we'll have you reapply and sign up on our website. Again, I apologize for the confusion there. Not sure how that happened, but I want to be clear that signing up on that website doesn't get you in line for us. The other thing you need to know is we want to get the vaccine, when we get it, in your arms as quickly as possible. So we're not planning to keep any on the shelf, hold stuff back, or slow this down. We want to be as productive as possible and get this out to the community to make sure we get everybody vaccinated as fast as possible. So we're not sitting on it. I want to make sure you're aware of that. As part of that, then, we're going to be expanding our COVID vaccine locations. So we're already right now in Phase 1A giving vaccines at the Washington Hospital and at the Washington Health System Green down in Waynesburg. And we're going to expand and have 3 sites soon. So in February, we're going to be announcing the opening of a location in Peters Township. We're going to be relocating down in Waynesburg, where we're doing it within the Washington Health System Green, to a larger spot within that facility in February as well. And then in February here in Washington, PA, we're going to move to a larger facility here in town so we can get as many people through as possible so that we can make sure that we maximize space, our talent and people, and then the vaccine as they come in. We're also going to be making sure that we do this via scheduled appointments. And again, we're going to do that through that online process. And so you'll request the vaccine. If you meet the criteria, we'll get back to you with the time and date, those kind of things. But we're only going to be doing it by appointment. So please don't show up at one of our sites unannounced and expect to walk in and get a vaccine. It's not going to work that way. We've had a couple of people ask, why are you doing it by appointment? And there's really two simple reasons for that. First and foremost, we want to make sure that the people who are scheduled and show up get a vaccine. And we want to make sure we don't waste a single dose. And so we want to make sure that every one of those are scheduled so that at the end of the day, not a single drop of that valuable commodity, the vaccine, goes to waste. The second reason is about you. We don't want a process where it's first come, first serve. We don't want people lined up outside in the winter hoping that they can get in. And on top of that, you don't want to be waiting outside for hours only to find out we ran out and had nothing to give you. And so we're going to do it by appointment so that when you get your time period and your date and time, you're guaranteed you're going to get a dose and we can get you in as much as and as quickly as possible. We've also gotten a lot of people calling just asking specific questions about the vaccine and their health condition, all that kind of stuff. Honestly, if you could stop calling a hospital, the best person to call for that is your primary care physician. They know you, they know your health conditions, they can answer these questions. The operators here at the hospital, the staff at the health system don't know that kind of detail and are not going to be helpful to you. So please call your primary care physician to have those discussions. So again, please be patient with us, be courteous. Remember, our staff are working hard to get this done for you as quickly as possible. It doesn't help to take your frustration out on them. We're at the mercy of the quantity of the vaccine that gets delivered to us and the guidelines that are being handed down from the state. And we're trying to work and react to that as quickly as possible. And we feel your frustration. We're in this together. So please be patient. We're going to get this all done. Our next video is going to be Friday, January 22nd. That would have been our normal video. We'll do that like always, but we wanted to get this out today because this news was hot. We know a lot of you are wondering what's going on. So until this coming Friday, thank you for watching this video. Stay safe, and I'll talk to you soon.